Hi, this is Michael Peluso with TCM Gynecology. This week's video is going to be about uterine fibroids. To begin with, the term fibroid is a bit of a misnomer. What these fibroids actually are structures called leiomyomas. And a leiomyoma is a benign growth or a tumor of smooth muscle tissue. Now, these smooth muscle tumors can occur anywhere in the body where smooth muscle is found, such as skin, eyes, uterus, bladder, and the gastrointestinal and even respiratory tracts. So when a leiomyoma is found within the uterus, it's known as a uterine leiomyoma, but more commonly, the uterine fibroid is the parlance that we hear and what we use. So throughout the slideshow, I will continue to refer to them as a uterine fibroid, but understand technically it's a uterine leiomyoma. There are several locations for uterine fibroids. We see what are known as intramural, subserosal, submucosal, pedunculated serosal, protruding submucosal, pedunculated submucosal, intraligamentar, and cervical. So what causes uterine fibroids to form in the first place? Well, there's no definitive answers like with endometriosis, but there are some good theories. Hormonal and genetic factors seem to play a role. We don't know for sure what causes fibroids to grow or to shrink, although we do know that there are influences from estrogen and progesterone. And we see that these do grow rapidly during pregnancy when certain hormone levels are high, and then they shrink when we use anti-hormone medications. So there is some role that hormones play in the display, the growth, and the recession of these growths, but we don't know the exact role that the hormones play. Let's look at some signs and symptoms of uterine fibroids. Only about 20 to 50% of uterine fibroids will display common clinical signs and symptoms. Let's take a look at a few of those right now. So abnormal uterine bleeding, palpable abdominal masses, abdominal pain, compression of adjacent organs. And what you see in this case oftentimes is as the uterine fibroid grows, it will apply pressure very commonly to the urinary bladder, producing urinary urgency or urinary symptoms. Profuse leukorrhea, infertility, secondary anemias from excessive bleeding, sometimes caused by uterine fibroids, and cardiac dysfunction risks are also associated. Let's take a look at some statistics around uterine fibroids. So who develops uterine fibroids? Age seems to be a factor. Women, especially in their 30s and 40s and through menopause. Family history, if you have a family member with fibroids, your risk does increase. Ethnic origin, African American are more likely to develop fibroids than white women. There's actually a huge statistical difference between African American women and Caucasian women, roughly a threefold difference affecting African American women that much more than Caucasian women. And this is something that we see in the research and in the literature. There's been a lot of studies about this. It's things that you can look up, and I'll be happy to also link a study to this as well. But it seems to disproportionately affect the African American community. Obesity is another risk factor in helping or contributing toward women developing uterine fibroids. And the eating habits, as you know, diet is a very contentious subject. Take from this what you will. This is from womenshealth.gov, talking about red meat and ham linked with higher risks of fibroids. There's a lot of debate about that, so I'm not going to go into that a whole lot. There are some risks during pregnancy and complications that can arise from uterine fibroids, but I want to make it clear that most women who have uterine fibroids and are pregnant will not necessarily need to see a high-risk OB. Most women who have fibroids will go through their pregnancy and it will be uneventful, but there are some complicating factors that can arise, and we're going to look at those now. So cesarean section or C-section can happen. Breech presentation of the baby is a possibility. Placental abruption is also possible, and a preterm delivery, again, is a potential complication of fibroids. But again, the majority of women who have fibroids do not necessarily present with these complications. How are uterine fibroids diagnosed and treated? As you can see listed here, digital pelvic exam, ultrasound, MRI, X-rays, CT, HSG, which is the hysterosalpingogram, sonohysterogram, and laparoscopy, hysteroscopy are really common techniques used to confirm the presence of uterine fibroids. So medications that we use to treat fibroids, if they're not large, if they're not causing problems with adjacent tissue, oftentimes women will take ibuprofen or acetaminophen to handle the discomfort of the fibroid. Iron supplements are commonly used if there is profuse menstruation to supplement iron that is lost from heavy blood loss. Low-dose birth control, again, we're getting more into hormonal control of this. Progesterone-like injections like the Depo-Provera shot, IUDs like Mirena, and GnRH agonists like Lupron are all medical interventions that you do see. Surgical interventions will involve the myomectomy, sometimes as far as a hysterectomy. Endometrial ablation, you do see. Myolysis, uterine fibroid embolization, and uterine artery embolization. These are common surgical options. Some non-standard treatments that are becoming more frequent are radiofrequency ablation and anti-hormonal drugs. So let's look at how TCM gynecology views uterine fibroids. First of all, as you know, a uterine fibroid does not exist in traditional Chinese medicine. There is no disease category known as uterine fibroid. So what do we do as practitioners of Chinese medicine? We do what we always do. We separate the apples from the oranges. While it is interesting to know that there is a diagnosis of uterine fibroid, for us in Chinese medicine, we have very specific criteria for identifying the pattern, identifying the Chinese medical disease, and then moving forward with treatment. So let's look at a few of those. The first step toward diagnosis in Chinese medicine is to reframe the Western disease diagnosis of uterine fibroid into what we commonly see in Chinese medicine as far as symptoms. So Chinese medical diseases, bianbing, is where we need to begin our process. So very often the symptoms that a patient presents with that has uterine fibroids are as follows. Concretions and conglomerations. Now these concretions and conglomerations in the context of Chinese medicine must by definition be palpable from the outside. What I'm trying to clarify here is that even though we have a Western diagnosis of uterine fibroids, if you can't palpate from the outside of the abdomen, we can't technically make a diagnosis of concretions and conglomerations. So that's one of the limitations of a traditional medicine, but if we're going to be technical about it. Painful menstruation is very common. Profuse menstruation is very common. Infertility, and even frequent urination. As I discussed before, as the fibroid applies pressure to an adjacent tissue, mechanically it may cause a symptom known as frequent urination, which is a disease category in Chinese medicine. So we can add that to our list. So it's important to ask the patient, what signs and symptoms are you presenting, reframe those into the Chinese medical disease category, and then from there, we'll begin our process of pattern discrimination. So I'm going to briefly go over some common patterns that are associated with these common disease categories in Chinese medicine. Let's take a look. So if you do palpate a mass from the outside of the abdomen and you diagnose concretions and conglomerations, these often present with blood stasis, qi stagnation, and or phlegm accumulation as their pattern diagnosis. Painful menstruation is usually from chi stagnation, blood stasis, or cold in the uterus. This is a very common one. Profuse menstruation often presents with replete heat, chi vacuity at its root. So if there's excessive bleeding, is what that means. Excessive bleeding is usually caused, if you remember from other videos, the causes of pathological bleeding in Chinese medicine, either chi vacuity not containing the blood, or heat pushing blood outside of its normal pathways. Infertility may have many causes. It's a secondary manifestation of several common Chinese medical disease patterns. Frequent urination, again, this is something that you can look at as a secondary symptom. And when you understand, especially if there's concretions and conglomerations involved, when you break those up, that symptom usually abates. So this video was meant to be the briefest of introductions to the concept of uterine fibroids from a Western perspective, as well as a traditional Chinese gynecological perspective. In the end, what we do is somewhat easier than what they do in Western medicine, because no matter how big the Latin name of something is, no matter how complicated all of the symptoms are, we as practitioners of Chinese medicine always just bring it home to the pattern of signs and symptoms, the Chinese medical disease that those signs and symptoms describe, and then pattern differentiation. And that's the beautiful part about Chinese medical gynecology, is when we boil it down, there are a handful of patterns that we see as clinicians over and over and over again that will account for so many Western disease names. So, moving forward, always remember, don't get caught up in the Western biomedical disease name. Always come back to the Chinese medicine, come back to the disease category, come back to the pattern discrimination. It will work for you so much better than trying to modify Chinese medicine to fit some biomedical understanding.